My dear students, today's topic would be a very important topic from microbiology perspective as well as from perspective of general medicine as well as neurology. So I would be taking up botulinism, and Clostridium botulinum would be the organism implicated. You have to remember that this botulinum toxin is a very important toxin, and basically it is a neurotoxin. You have to remember the role of acetylcholine at the neuromuscular junction, and in this case we have got the blockage of the acetylcholine release. So let's go first of all about the Clostridium botulinum. Now first of all, you have to remember that this organism is having microbiological characteristics in the form of it being a gram-positive organism, and important about that is it is a spore-forming bacteria. So important gram-positivity and spore-forming capabilities. Then it is an obligate anaerobe, and as I mentioned, it just causes the secretion of this neurotoxin, and this neurotoxin is implicated in mostly in home canned food or smoked food, and ingestion of honey is related as a factor of botulinism, especially in case of infants. Now that's not all. We can have this organism be implicated in bioterrorism, that we can just have it massively produced and causing a lot of damage. Now, in addition to that, what are the important features which a patient with this toxicity has got? You have to remember that botulinum toxin can cause important affection of the cranial nerves, especially, number one. And number second, it would be involved in causation of symptomatology like dysphagia, and in addition to that, diplopia, and in addition to that, dysarthria, and in addition to that, dysphonia. And one important characteristic would be descending paralysis. And another important feature on examination would be dilated pupils. So you can see D, almost 6 Ds. Dysphagia, dysphonia, diplopia, dysarthria, descending paralysis, and dilated pupils. So these are some of the features, these Ds, which we remember classically in case of botulinism. In addition to that, we can be having these pupils which are fixed and dilated, but very important fact about botulinism is that the mentation is preserved. So that's very important about this condition. Now, as far as the pathophysiology of the toxin is concerned, there are multiple toxins which are just secreted by the botulinum organism, but you have to remember that this botulinum toxin predominantly happens to be a neurotoxin, and it causes this classical descending type of paralysis. So these are some of the very important facts about Clostridium botulinum, and you have to remember that once we have a patient with poisoning by virtue of this toxin, it is to be immediately addressed, and important is that the management would be by virtue of an antitoxin, because severe cases of botulinism can lead to respiratory failure. So you have to take care about the respiratory status of the patient. I think these small points, this small list of points which I just mentioned to you, you would be remembering them, and this classic of Clostridium botulinum poisoning. Thanks a lot.